it's challenging sometimes when I see everybody with GERD put on a proton pump inhibitor or something to suppress their acid when, like I've mentioned here, that's really not necessarily the cause.
Ayur means life, and Veda means wisdom. So it's the wisdom of life, the wisdom of living, the wisdom of longevity. So when you think about longevity medicine, you might have heard this in this conference or elsewhere. Our longevity is going down, especially in the US. We've gone down by 2.5 years over the last, since pandemic. And so this is the first time in history where, if anything, our longevity is decreasing versus increasing, despite all that we're spending on healthcare, all that we're spending, and all of the novel tools that we have. How come our longevity is going down?
In menopause, when estrogen and progesterone decline, basically, that gut barrier integrity goes away, which increases the risk for something called microbial translocation, meaning as your gut barrier is no longer as good as it was, microbes can then get translocated, meaning they get through the gut wall and they can get into the bloodstream.
This is your metabolism, or this is how your biochemical pathways are talking. In fact, this is not your metabolic pathway. This is a picture of the London tube system, which I feel is very appropriate to visually show that there's so much talk going on in our bodies all the time. Our metabolism, our biochemical pathways, they're always talking. This is important so we can develop a diet and lifestyle strategy so we can age the best way we can through food.
We focus on these two branches of the autonomic nervous system and their output to the gut to make sure that that is optimized and that there's no hypersympathetic tone to the gut, right? Because as we know, for the gastrointestinal system, the parasympathetic division leads to proper peristalsis and motility of the gut, proper secretions and movement of all those secretions and enzymes and everything within the gut. Whereas if there was an imbalance and there was more sympathetic tone towards the gut, that would shut off a lot of those things, because the sympathetic nervous system, if you're in that fight or flight mode, is going to shut down that peristalsis, shut down those secretions. So as an osteopath, we can determine really whether there is an imbalance within the autonomic nervous system.
So what we're going to talk about today is acne, hidradenitis suppurativa, I will call it HS from now on, rosacea, eczema, and how the gut and the skin relate to each other here.
So sexual health is very complicated, but I tried to break it down into some basics. So in order to have a good sexual health, and I'm talking about libido, sex drive, motivation. So I kind of broke it into 4 categories. One, you need good sex hormones. They're a part of this picture.
So when you eat, we all know we eat, our body releases insulin. Insulin helps to transport glucose into the cells where they can utilize it for fuel. So after you eat, that's what happens. But once insulin transports all the glucose that you have into your cells, the levels start to slowly drop. And when the levels of insulin start to drop, your body is trying to shift gears and trying to figure out what the next steps are. So think of it this way: is your body never wants to do hard work unless it has to. But we have to kind of force it to do a little bit of hard work, and I'll tell you why.
Some examples, I'll talk about the first 2, mindful eating. I love this practice. It's not always feasible for those of us who are very busy, but it's very important. I try to have people at least try to practice it once a week. It's a practice where you're putting your phones away and you're really engaging all your senses into the meal before you.
25% of the population has chronic gastrointestinal symptoms that don't quite meet criteria for a diagnosable disorder of gut-brain interaction, and yet they still have these bothersome chronic symptoms. So I present this to just tell you the magnitude of the problem, to frame not only my discussion, but this entire conference.
Our gut flora works as a barrier, a very educated, very high-functioning barrier that decides what we absorb and what we don't.
95% of patients that I see with heartburn are on acid suppression. And if we know that 90% of them don't have increased acid production, why are we doing that? I think it's worth a little bit of a deeper dive into why they're having the symptoms and treating those symptoms appropriately.
Our microbiome is unique. Each individual has their own microbiome, and that microbiome itself is not static and may change over time. And the contents of your own microbiome will help you, will influence your susceptibility to disease, and also may influence pain sensitivity.
These big companies came about. They built up these $99 tests, which is very cheap to get tested. And however, there's like this big pool of data now they can reanalyze and analyze, so on and so forth. But I will start off with a word of caution, because complexity of genetic testing is so much that I feel when it goes to the consumer, they give this very big and genetics, this is happening, this can be happening, you're at risk for this. I feel it fuels more anxiety for the consumer or the patient.
But what we don't talk about are these kinds of symptoms like insomnia. So we learned that histamine contributes to sleep-wake cycles. So too much histamine can keep people up, and in that can cause a lot of anxiety. So is it chicken or the egg? I'm not sure which one comes first. Is it the anxiety keeping people up?
Having the right amount of fiber and the right quality of fiber will allow us to continue or maintain this balance in the gut flora, but also will allow us to start producing appropriate amount of these short-chain fatty acids that self-stimulate the production of GLP-1s that we all know that will help us to reduce the appetite, to improve the glucose levels, and to reduce weight. And this will be translated to a signal in the brain through the gut-brain axis that will tell us, okay, you are full right now, you should not be eating more, time to stop.
The conscious mind is like the ship of a captain that's giving all the orders, but the subconscious mind is like the crew that's making sure it all happens. So I'll get to this in a few slides, but the importance of our language, because if we believe that the world is terrible, that we're never going to get better, the conscious mind is then directing your subconscious mind to find all the evidence to support that.
Meaning your traumas, all your activation, maybe even your relaxations, they all stay in vagus, in this nerve. It can hold on, it has this muscle memory.
What's also less frequently known is that sometimes these gut bacteria can also upregulate themselves because the hormones decline. And so they do that as a protective mechanism to bring more hormones back into the circulation. So it's wonderfully complex. It's always helpful, if you want to look into that for yourself, to know a doctor who knows how to check your serum levels of your hormones and your gut stool testing, so they can check for this estrobolome activity and they can guide you what to do about it.
That microbiome testing at present is unreliable. The concept makes sense. Take a sequence from the microbiome, most often stool, and sequence it and see what clinically useful information we can get about a diagnosis or a treatment. That seems simple. In reality, it is far more complex.
So people who are dopamine natured or dopamine dominant tend to be highly competitive, goal-oriented, very driven, strategic thinkers. So think of CEOs, leaders, people who are in leadership positions. Actually, some celebrities are also dopamine dominant, and that's their dominance. So how do we make dopamine? Same thing. Precursor is tyrosine. So tyrosine is another amino acid that's present in food. And when we eat tyrosine, it converts to tyramine in the body, which then converts to dopamine.
So we talk about the physical, yet I think what's hard to talk about, and it's something I've spent a long time trying to really put words into, and I use this ancient model to discuss it, is what is that emotional gut? What's that intuitive gut? What's your stress response system doing in response to triggers? And this is tied to that enteric nervous system.
The gentlemen you see in this photo are gentlemen from the Catawba Islands. And in the Catawba Islands, it is known that acne essentially doesn't exist. And we think that's probably related to their diet. They eat mostly high fiber rich foods, lots of lean proteins, not so much cow milk and things like this. So it's interesting to see how various civilizations, various dietary practices can play a role in our skin.
So what an osteopath can then find on exam is actual findings within the musculoskeletal system at that level, right? So you can see hypertonic muscle at that level. You could find tenderness at that level, erythema, all these different things, joints at a place, which coincide with that organ. That's why we call it the viscerosomatic reflex.
So in my practice, I try to focus a lot on history taking for patients and I ask that patients actually bring their partner with them.
And the common language for much of the gut-brain connection is modulation of immune activity. And chronic pro-inflammatory immune activity is increasingly being recognized as a fundamental element of, and I would say in their case, they've cited it for neurodegenerative disorders, but I would say, likely this is the fundamental element of some of this gut-brain connection and influences on brain health from the gut.
And I love the phrase, what happens in Vegas stays in Vegas.